Okay, today we will speak about bones of the thoracic wall. By the end of this lecture, okay, the student should be able to describe the general topography of thoracic cage, define the thoracic inlet and outlet, describe parts, articulation, relation, ossification of the sternum, describe the general features and articulation of the ribs, differentiate typical and atypical ribs, identify the sternum, outline structure of vertebral column, differentiate between cervical, thoracic, lumbar vertebrae, discuss the clinical manifestation of cervical rib and rib fracture. Okay.
Thoracic cage. We will define the thoracic cage. It is an osteocartilaginous framework. This is an osteocartilaginous. This is osseous part and this is cartilaginous part. Okay. Shape. It is conical in shape. Has anterior wall shorter than posterior wall. Formation of thoracic cage has the following structures. Anterior, formed of sternum and costal cartilage. Behind or posterior, formed of thoracic vertebrae and ribs. On each side, formed of the shaft of the ribs on both sides. Function of thoracic cage. Number 1, protect and support the thoracic viscera, which includes the heart and lung and the mediastinal structures. What is meant by mediastinal structure? This is a structure between the two lungs and the pleura, including heart and the great vessels and nerves. Number 2, share in respiratory movement. Thoracic cavity has an inlet here, outlet here, and thoracic cavity. We will start speaking about the thoracic inlet. Boundaries of thoracic inlet. Okay. Anteriorly upper border of manubrium sterni. Posteriorly first thoracic vertebra. On each side formed by inner border of the first rib. Through the inlet, okay, the thorax is connected with the root of the neck. Different structure passing through the thoracic inlet, including structures in the middle line, trachea, esophagus, and recurrent laryngeal, left recurrent laryngeal nerve in between. And also here, thoracic duct behind the left border of the esophagus. On both sides, there is the lung apex covered by pleura. Another structure present here, including the great vessels and nerves. Great vessels here on the left side, left common carotid artery, left subclavian artery, left brachiocephalic artery, and two nerves, left phrenic and left vagus. On the right side, brachiocephalic artery, right brachiocephalic vein, phrenic nerve, vagus, and phrenic nerves. Posteriorly in front of the neck of the first rib here, three structures arranged from medial to lateral. This is sympathetic chain, superior intercostal artery, and laterally primary ramus of first thoracic spinal nerve. Okay. Structure here covering, okay, the apex of the lung called suprapleural membrane or Simpson's fascia. It is a triangular fascia extended from the endothoracic fascia, okay, as an apex and base. Apex directed posterior attached to transverse process of C7, and the base directed anteriorly and laterally attached to the inner border of the first rib and its costal cartilage. Function number 1, protect the cervical flora and the apex of the lung, prevent, okay, inward suction of structure present at the root of the lung during inspiration, and prevent upward bulging of the apex of the lung during expulsive expiration, forcible expulsive expiration. Here, this structure lies superficial to the suprapleural membrane, okay, subclavian artery and vein, and this is line representing the fascia, suprapleural membrane here, the green line here, okay. This slide showing thoracic outlet, formed of, it is sloping downward and backward, formed of anteriorly xiphoid process on both sides costal margin, and behind the 12th thoracic vertebra and the last two reps, 11th and 12th reps. This slide showing anterior and lateral view of the sternum. The sternum is flat bone, okay, formed of the following three parts. This is manubrium, this is body, and this is xiphoid process. The manubrium articulate with body at manubriosternal angle, also called angle of Lewis, and also the body articulate with xiphoid process at sterno-xiphoid joint or xipho-sternal joint, okay, here, showing the following feature: the upper border of manubrium showing jugular notch or suprasternal notch here, okay. On both sides there is clavicular notch for articulation with medial end of clavicle forming sternoclavicular joint. Lateral to the jugular clavicular notch there is notch for the first costal cartilage, okay, articulating with it. The manubrium articulate, okay, here with the first and part of the second costal cartilage, while the body articulate with from the second to seventh costal cartilage here, okay. And according to the articulation with the costal cartilage, the ribs are classified into two types of ribs: true ribs and false ribs. True ribs, the ribs are attached to the sternum and they are 7, while the ribs not attached to the sternum are called false ribs. The false ribs are also divided into vertebrochondral, the ribs which are connected with each other by cartilage, including 8th, 9th, and 10th ribs, okay, and floating ribs, the last two ribs, 11th and 12th. They are not connected with the sternum or with the costal cartilage. Transverse planes and levels of the thorax. Plane of thoracic inlet, okay, extended from upper border of the manubrium to the upper border of first thoracic vertebra. Plane of thoracic outlet extending from the xiphoid process to the lower border of the 12th thoracic vertebra. Plane of sternal angle extending from sternal angle here or angle of Lewis to the lower border of T4 or disc between T4 and T5. Okay, this is very important. Also the upper border of manubrium, okay, lies opposite the lower border of T2, second thoracic vertebra. Okay, the sternal junction, okay, lies opposite the body of ninth thoracic vertebra. اوكي الارقام دي بتبقى مهمه في الام سي كيو. اوكي level of sternal angle, level of upper border of sternum, level of the sternal junction, level of the void process and its plane. Okay, this is very important. Structure at the plane of sternal angle. Different structure present at the plane of sternal angle, including here. Okay, beginning and termination of aortic arch. Okay, termination of ascending aorta, beginning of descending thoracic aorta. So the lower border of T4 or disc between T4 and T5. Bifurcation of trachea, bifurcation of pulmonary trunk. Okay, thoracic duct reaches the left side of the esophagus. Okay, this is very important structure, important also for MCQ. Important points related to the sternum clinically. Number one, including sternal puncture. Okay, some people okay suffering from tumor like okay leukemia, we can take specimen of bone marrow from the sternum. Why sternum is preferred site for to take a specimen of bone marrow? Because number one, the red bone marrow, okay, is active throughout life, okay, which present in the sternum. Number two, the sternum is covered by thin layer of compact bone and lies subcutaneously. So with we can take the biopsy by a needle and through local anesthesia injected at this area. Number two, sternal splitting. It is important, okay, for cardiac surgery, and it is very important. We can, the whole sternum may be split, okay, longitudinally in cases of cardiac surgery, all and maybe split only the manubrium in cases of surgery for retrosternal goiter, in case of thyroid enlargement. okay, في بعض الناس بيبقى عندهم goiter، الغدة الدرقية متضخمة، ممكن تبقى تextend behind the manubrium. We can split the manubrium to remove the retrosternal goiter or even any mass behind the manubrium. Okay, so the clinically the sternum is important in case of sternal puncture and splitting of sternum. And also we can, through the sternal angle, we can counting the ribs. Okay, counting the ribs by okay detecting the sternal angle, we will descend in the middle line from the jugular notch to reach the sternal angle. Okay, we can palpate it, and at the level of sternal angles there is attachment of the second costal cartilage. We can counting the ribs and intercostal spaces. It is very important as we can detect cardiomegaly. Okay, detect aortic regurgitation or okay different structure can be detected through the counting the ribs. Classification of ribs. Okay, the ribs are classified according to articulation with the sternum into true ribs and false ribs. True ribs, again, the ribs attached to the sternum, okay, and they are 7, while the false ribs, okay, including the lower 5 ribs, okay, and the false ribs are also classified into vertebrochondral, costal, and vertebrochondral, and the true floating ribs. The last 2 ribs are called floating ribs because they are not attached to the costal margin and not to the sternum. Another classification classified according to articulation with vertebrae into typical and atypical ribs. Typical ribs include ribs from 3 to 9. All typical ribs display both transverse axis, have bump handle, and anteroposterior axis, bucket handle. The ribs move in two direction. On the side, this is called bucket handle, and from anteroposterior, this is called bump handle. Upper ribs prefer bump handle, while the lower ribs prefer bucket handle. Bucket handle increase the transverse diameter of the thoracic cavity, while the bump handle increase the anteroposterior diameter of the thoracic cavity. Atypical ribs including the first, second, 10th, 11th, and 12th rib. Here, the typical rib is formed of head, followed by neck, costal tubercle, shaft, and the anterior end cup shape as it articulates with the costal cartilage. The head carrying two articular facets and crest in between. The costal tubercle has area for articulation with the transverse process of thoracic vertebra and area non-articular part which connected with ligaments with the thoracic vertebra. The upper border is rounded, while the lower border is sharp, showing costal groove containing neurovascular bundle. This is the picture of the typical rib. Lateral to the costal tubercle lies the angle of the rib. Atypical rib including this is the first rib, which is atypical. Why it is atypical? The first rib has a superior and inferior surfaces instead of outer and inner, and inner border and outer border instead of outer and inner surfaces. The angle of this rib coincide with its tubercle. The head carrying only one articular facet. This point showing scalene tubercle, insertion for scalenus anterior muscle. The second rib is atypical also. Why it is atypical? Because this is a transitional rib between the first and the third transitional rib. Has an oblique surfaces, showing here tuberosity for serratus anterior muscle attached to this area. This is its rib. This is atypical. The 10th rib, 11th, and 12th rib are atypical because the 10th, 11th, and 12th, the head carrying only one articular facet for articulation with the head. The last two rib, 11th and 12th, the anterior end is pointed, and has no costal groove. The 11th may have costal groove, and has no neck or costal tubercle. The last two ribs have no neck or costal tubercle. So these ribs are atypical ribs. This is information about atypical ribs. Why each rib is atypical. This slide showing fractures of different ribs. The fracture may be simple fracture, transverse, oblique, overlapping here, separating, chondral different type of fracture. Okay, the fracture may be at one side, okay, or maybe at different sides on the same ribs. Okay, here on one side of the rib, here at different sides, here segment of ribs is fractured, okay, or separated from the attachment. Okay, here, okay, this is very important in these cases. Okay, fracture of rib may occur through direct trauma or by compression as in car accident. Okay, fracture result in severe pain due to friction between the fractured ends. Okay, and the fractured rib may injury skin or injury the internal structure, pleura, lung, okay, or even heart or great vessels. Okay, while in case of segment of ribs are fractured, okay, this segment will move in direct in opposite direction with respiratory movement, as in case of inspiration, okay, this segment, okay, will sucked inward due to negative intrathoracic pressure. Okay, while in cases of expiration, this segment, okay, will, okay, puffed outward or bulges outward due to positive intrathoracic pressure. This movement called paradoxical movement. يعني بتبقى حركات عكسية من السيجمنت اللي هي fractured segment، بدل ما هي تتحرك at the same time with the ribs سواء inward او outward، لا، هي لو الريبس كلها او الثوراسيك كيدج بيتحرك inward هي بتتحرك outward، لو الريبس بتتحرك outward هي تتحرك inward. اوكي، clinical application related to the ribs. Okay, including this is number one, cervical rib. Okay, additional rib may be present at cervical region and also may be present at lumbar region. The commonest site for additional rib at the lumbar region. Okay, but here we will speak about the cervical rib. Okay, additional lumbar rib, okay, more common but less dangerous. Okay, while the cervical rib less common but more dangerous. Why the cervical rib may be, okay, dangerous? Okay, because it may compress, okay, the lower trunk of brachial plexus nerves, okay, passing from the root of the neck to the upper limb to supplying it. Okay, so this will result in sensory and motor manifestation in the upper limb due to compression of the lower trunk of the upper limb. This manifestation, okay, including, okay, numbness on the medial side of the upper limb and wasting of muscles of the hand. Okay, and they may also compress the subclavian artery, resulting in ischemic manifestation, easy fatigue in the upper limb. Okay, and they may also result in balloon-like dilatation here called aneurysm, and this will, okay, may be complicated by, okay, thrombus formation, and severe complication may occur from this aneurysm. Okay, this is very important regarding cervical rib. Okay, some people have cervical rib but without any manifestation. Okay, also cervical rib may be, okay, only incomplete, may be complete. Cervical rib may be, okay, bone structure, may be fibrous structure, may be mixed, part is bony and another part is fibrous. Okay, the fibrous, if the cervical rib fibrous, okay, it is more dangerous than bony structure because this fibrous lobe will, okay, surround the subclavian artery and also lower trunk of brachial plexus, causing more complication. The second point is fractures of the rib, which discussed before. Okay, fracture of the rib may be, okay, produced by direct trauma or compression of the thoracic cage as in car accident. Okay, there is simple fracture and, okay, complex or compound fracture. Simple fracture of the rib at one point, this is produce severe pain, while, okay, fracture of the ribs at different points, this is produce, okay, paradoxical movement of the chest. Here this image, okay, or this slide showing, okay, the paradoxical movement of respiration due to fracture segment of group of ribs here, okay? In cases of here, in cases of expiration, okay, there is decreased diameter of the chest. At this time, this segment of ribs, okay, buffed outward, okay, while in cases of inspiration, the thoracic cage diameter increase. At this time, this segment will sucked in due to negative pressure in the thoracic cage. Vertebral column, okay, formed of 33 vertebra, has an average length about 70 centimeter in adult male and 65 centimeter in adult female, okay. Divided into 7 cervical vertebrae, 12 thoracic, 5 lumbar, 5 sacral, and 3 to 5, okay, coccygeal vertebrae, okay. This is the cervical part, okay, thoracic part, okay, concave anterior, while, okay, this is an adult, okay, cervical part in adult, convex anterior, thoracic vertebrae, concave anterior, okay. This is, okay, a change between the thoracic and, okay, between the lumbar and sacral vertebrae. This is the last part, okay, the coccyx, okay, formed of 3 to 5 or from 2 to 4, okay. The authors, okay, okay, are have differences in this number, okay, of the coccygeal vertebrae. Curves of vertebral column, okay, there are two curves, primary curvature and secondary curvatures. Okay, secondary curvatures occur at cervical part and lumbar part or lumbar region, okay. Primary curvature, okay, present, okay, in the inferior and at pairs, okay. The vertebral column, okay, like this, resemble or looks like C shape, okay, and this position, okay, is adapted to the position inside the uterus to occupy a small size, okay, as possible, okay. This is at birth, the primary curvature is C shape, concave anterior. Development of secondary curvatures, okay. Here, this is primary curvature, okay. Number one, cervical lordosis, okay. The cervical vertebrae become convex forward, okay, at the time of from 3 to 4 months of life, okay. Because here the baby started to raise his head or due to carrying the head upright, okay, to support the head. Thoracic kyphosis present from the start but increase with time, okay, throughout postnatal development. Lumbar lordosis, okay, the upright walking, okay, occur between the 12 and the 18 months, okay, when the baby started to walk to support his body, okay. Sacrum and coccyx kyphosis, okay, the same as before. This is the secondary curvature, okay. This is from anteroposterior. Side to side curvature, okay. The vertebral column is slightly convex to the right and right-handed person, slightly. But if this, okay, the vertebral column is, okay, tilted to one side with large degree, this is, okay, means a problem, which, and it is called scoliosis. Any part of this areas, okay, like this thoracic convex, this is concave anterior thoracic, okay, curve, if this concavity increase, this is okay means kyphosis. يقول لك ده واحد عنده أتب، يبقى في درجة kyphosis موجودة أو مسموح بيها، ولكن لما بتزيد increase more than normal, this is called kyphosis. Also, if there is tilting of the vertebral column, okay, to one side more than normal, this is means okay scoliosis. Okay. Characters okay of vertebrae here. Okay, each vertebra okay has a body and 7 processes and 2 arches. Okay, this is the body directed anterior, and the body variable in size according to the site of the vertebra in cervical or thoracic, lumbar, okay, and so on. Okay, while here this is the vertebral arch, okay, or neural arch. The vertebral arch form of this part called pedicle, okay, and this is called lamina. The pedicle and the lamina together forming vertebral arch. The two arches together with a part of body forming vertebral foramen. The vertebral foramina together forming vertebral canal in which spinal cord, vessels, and meninges passing through it. This is the vertebral foramen. And 7 processes including 2 transverse processes, okay, 2 superior articular processes here, and another 2 inferior articular processes, okay, directed downward and carrying articular facet, and a spinous process directed backward and downward. Okay, this is the parts of vertebra. Between the pedicles, okay, there is here is a notch, okay, from superior aspect and inferior aspect to form intervertebral foramen, through which the spinal nerves and vessels supplying the spinal cord passing through it. This is the body, okay, this is the pedicle, this is the lamina. Again, okay, this is lateral view of thoracic vertebra, typical thoracic vertebra. Okay, this is the body. This is okay superior articular process carrying superior articular facet for articulation with the inferior articular facet of the vertebra above, and here inferior articular processes carrying inferior articular facets for articulation with the superior articular facets of the vertebra below. This is a spinous process, transverse process carrying here transverse costal facet for articulation with the costal tubercle, articular facet of the costal tubercle here. And this is superior demifacet, inferior demifacet for articulation with the ribs. Okay, an important point, okay, each rib, okay, of the typical rib articulate with the 2 vertebrae, articulate with the 2 vertebrae, okay, vertebra above and vertebra below, and the rib take the number of vertebra below. If articulate with the second and the third, okay, the rib takes the numbering of the third thoracic, the third vertebra. Okay, superior articular process and facet, okay, inferior articular process, okay, transverse costal facet, okay, for articulation with the articulated facet of the costal tubercle, spinous process here and here, okay, the vertebral foramen, okay, or neural foramen, okay, together the vertebral foramina forming the vertebral canal. Okay. This is a cervical vertebrae, okay, has a body, okay, transverse processes, spinous process, superior articular, inferior articular, okay, process and facets, okay. But the cervical vertebrae, okay, showing an important structure here. This is called foramen transversarium or transverse foramen in the transverse process. Okay, this is important for passage of vertebral artery. This is an artery passing to the cranial cavity to supply part of the central nervous system. Okay, so it is important here presence of this foramen. This indicate that this vertebra is cervical vertebra. Okay, the spine is bifid. This is the characters of okay thoracic. Sorry, this is the characters of typical cervical vertebra. Atypical cervical vertebra including the first, second, and the seventh cervical vertebra, while the third, fourth, fifth, and sixth, this is are typical cervical vertebrae. Okay, atypical cervical vertebra, this is the first, okay, cervical vertebra, okay, called the first called atlas, okay, ring-like, has no body and no spine, okay, so it is atypical, so it is atypical. The second cervical vertebra, okay, has a dense process, okay, here over the body, so it is atypical, okay, and also it is called the axis because it forms an axis for the atlas, and the atlas rotate around this dense process, okay, producing a lateral rotation of the neck, okay. The seventh cervical vertebra is atypical because it has pointed cervical spine, pointed not bifid، اوكي مش مشقوق. يبقى انا قلت من التيبيكال cervical vertebrae ان السباين بتاعها يبقى بيفد، هنا هو not bifid and it is pointed، okay. The most palpable, okay, spine on the back at the root of the neck, okay, is the seventh cervical vertebrae, and we can use it to, okay, counting the spines of the vertebrae, as it is important in cases of spinal anesthesia. This is very important، okay. لما حد يجي ياخد بنج نصفي احنا بنضطر نعد السباينز دي عشان ندخل بالنيدل بتوين الفرتبري، وده بيبقى مهم عشان ما اعملش انجري في السباينال كورد. Okay, in adult, the spinal cord, okay, terminate between L1, L2, okay, so it is advised to introduce the needle between L2, L3, L3, L4, okay, to inject spinal anesthesia، اللي هي في حالات البنج النصفي ان احنا نحقنه فين؟ ما بين L2 L3 او L3 L4 يكون افضل. كورد. typical thoracic vertebrae، اولا ما دام الفرتبرا هاز نو فورامين ترانسفيرسيريم يبقى هي مش سيرفايكال، يبقى بعد كده ابدا احدد هل هي ثوراسيك ولا لامبر. لا، فيها ارتكيوليشن، فيها فاسيتس فور ارتكيوليشن هنا على السايدز اوف ذا بادي اند ترانسفيرس بروسيس، ذيس از ثوراسيك فيرتبرا. يبقى ما دام في ارتكيوليتد فاسيتس على البادي او على الترانسفيرس بروسيس يبقى دي ثوراسيك. طيب التيبيكال ثوراسيك فيرتبري بيقول لي ان البادي بتاعها بيكون هارت شيب زي ما احنا شايفين هنا، تمام. الكنال بتاعتها بتكون مور اور ليس راوند، اوكي. بعد كده بيكون على السايدز في سوبيريور وانفيريور ديمي فاسات، اوكي. وهنا على الترانسفيرس بروسيس بيكون في ارتيكولار فاسات فور ارتكيوليشن ويز ذا ارتيكولار فاسات اوف ذا كوستال تيوبركل. السباينس بروسيس بتاعها بيكون بوينتد ودايركتد باكورد اند داونورد، اوكي، اند لونج. Non-typical thoracic vertebrae, okay, the first thoracic, okay, is atypical. Why? Because it has carrying, okay, one complete facet related to upper border and the half facet related to the lower border. Okay, the ninth, okay, have superior demi facet only. The 10th, 11th, and 12th, okay, have complete articular facet on the body or on the pedicle, okay, here. How can we differentiate, okay, 9th from 11th from 12th, okay. 9th had articular facet at the transverse process, 11th at 12th has no articular facet at the transverse process. While we can differentiate 11th from the 12th, okay, the inferior articular facet in all thoracic vertebrae are directed, okay, anteriorly, while the inferior articular facet in the 12th thoracic vertebra are directed, okay, laterally, okay, looks like the articular facet of the lumbar vertebrae. Lumbar vertebrae, okay, has a large size, okay, and robust, okay. السباين بتاعها بيكون broad and short, okay, very strong, okay. Has no foramen transversarium and also has no, okay, articular facet on the transverse process or on the body. Okay, a sacrum is characteristic, formed of 5 fused vertebrae together, okay, like this, okay, and this is the coccyx. The coccyx, okay, may be formed from, okay, 2 to 5 vertebrae, okay, 2 or 3 or 4 or 5, okay, fused small triangular part here. This is called the coccyx, articulate with the sacrum here. Joints between the vertebrae, okay, secondary cartilaginous joint, okay, and synovial joints. Okay, the vertebrae articulate with each other by 2 types of joints. Okay, here this is the intervertebral disc, an example for secondary cartilaginous joint, and also the articulation between the articular processes. This is called synovial joints. Okay, plane type, non-axial plane type, synovial, non-axial plane type. Okay, the most important is the intervertebral disc. Okay, it forms, okay, about 1/4 of the length of the vertebral columns. This is number one. Okay, the vertebral disc is thick, okay, in the cervical and the lumbar region. Why? Because this region, the movement occur mainly at these regions, okay, at cervical and the lumbar region. Okay, the intervertebral disc are shock absorbers. Okay, مهمين جدا. Okay, also this disc deteriorate with age. Okay, يعني بيحصل فيها deterioration or بيحصل فيها degeneration with aging, and this may result in a case called disc prolapse, compressing the spinal nerves here. Okay, this is spinal cord and this is a nerve. Okay, exit from the intervertebral foramen. There is a great difference between the vertebral canal or vertebral foramen and the intervertebral foramen. This is called intervertebral foramen, while the spinal cord passing through the vertebral foramen. Vertebral foramen. Vertebral foramina together forming vertebral canal. But here, this is spinal nerve passing through or exit through the intervertebral foramen. Okay, if this disc, okay, bulged, okay, posteriorly or posterolaterally here, this will compress spinal cord and also compress here spinal nerve, producing severe manifestation, okay, like case of sciatica in case of lower limb. ناس كتير يبقى عندها ألم شديد أو severe pain في اللور لمب في اريا معينة، يبقى ده نتيجة ان حصل لهم ديسك برولابس in الانترفرتبرال disc compressing spinal nerves at its exits. Okay, the intervertebral disc, okay, here, okay, this is lateral view, this is superior view here. Okay, formed of 2 parts. Okay, this is, okay, called annulus fibrosus, okay, fibrous part, okay, in the form of circle, while the central part is jelly like material called nucleus bulbosus. Nucleus bulbosus. Okay, ligaments, okay, of vertebral column. Okay, anterior to the bodies there is anterior longitudinal ligament connecting the bodies and the intervertebral discs together. Posterior to the body, okay, inside the vertebral canal here, this is called the posterior longitudinal ligament, also connect the bodies and the intervertebral discs together. Okay, between the tips of spines there is a ligament connecting the tips of spines together called the supraspinal ligament. Between spines and each other, okay, there is another ligament called the interspinous ligament. Between transverse processes, okay, there is intertransverse ligament. Okay, between lamini together, between the lamini together there is, okay, ligamentum flavum. Ligamentum flavum. Okay, flavum اللي هو yellowish in color. Okay, flavum means يعني yellowish in color in Latin word. Okay, range of movements of vertebral column. Okay, here in cervical region. Okay, okay, we can, okay, produce like flexion and extension for 45 degree. Okay, and produce, okay, rotation for 80 degree only, and produce, okay, lateral flexion also for 45 degree. While in the lumbar region, okay, or thoracolumbar region, okay, we can produce a flexion for 90 degree but produce extension for 30 degree. Okay, produce lateral flexion either to the right or to the left, okay, 30 degree, and produce, okay, lateral rotation only 30 degree. Okay, here, okay, this is part is more practical. Okay, how can we identify the vertebrae from each other, or how can we differentiate the vertebrae from each other? This is important for, okay, practical exam. Okay, here, okay, if there is foramen in the transverse process, this is cervical vertebra, and if the cervical vertebra, okay, we can differentiate it. It is atypical or atypical. Okay, if if there is no body, this is C1 or atlas. If there is dense process, this is called the axis or C2. If the body of the spines of this vertebra is pointed, this is seventh cervical vertebra. Okay, this is a typical cervical. Okay, have the features of typical cervical vertebra. If this vertebra has okay facets on the body and the transverse processes, this is thoracic vertebra. And also we can differentiate typical from atypical, but the most important is typical thoracic vertebra. typical thoracic. once ان انا اشوف facets على السايتس بتاع البادي and transverse process, this is a typical thoracic vertebra. And here, if there is no foramen transversarium, okay, or articular facet on the body, this is lumbar vertebra. lumbar vertebra. اوكي، كتير من الطلبة بيقول ان هي حجمها كبير فتي تبقى لمبر، حجمها صغير دي تبقى كذا. لا، مش بالحجم according to للفرتبرا. ما احنا قلنا ان اللاست ثوراسيك فيرتبرا فيرتبري دول بيبقى حجمهم كبير وبيبقوا لوكس لايك اللمبر، بس اللي يميزهم ايه؟ في ارتيكولار فاسيت اور نوت. وانس ان انا ما لقيتش ارتيكولار فاسيت على البادي ولا الترانزفيرس بروسيس ولا في فورامين ترانزفيرسيريم موجوده في الترانزفيرس بروسيس، دي تبقى لمبر. اوكي، في فورامين ترانزفيرسيريم يبقى دي سيرفايكل. في ارتيكولار فاسيت على السايتس بتاع البادي والترانزفيرس بروسيس، دي ثوراسيك. اوكي، this is an important. اوكي، ما نشغلش بالنا قوي بتيبيكال واتيبيكال. اوكي، في الثوراسيك فيرتبري. اوكي، the most important is typical thoracic vertebra. Okay, I will discuss with you the following question here. Okay, ribs are counted starting from the second rib. Okay, explain why. Because okay, the first rib is overlapped by the overlapped by the clavicle, and also we can easily detect the sternal angle, and the second rib lies opposite the sternal angle, so we can start counting from the second rib. Bone marrow biopsy can be obtained from the sternum because number one, the sternum lies subcutaneously. Number two, has okay thin layer of compact bone. Number three, through needle and local anesthesia, we can introduce and obtain this biopsy. Okay, for examination. Paradoxical movement of respiration in crush injuries because okay multiple ribs are injured at different sites. Okay, so this segment of ribs can move in opposite direction to the movement of the ribs. The last ribs to the last ribs to be fractured are the upper two and the lower two ribs. Okay, the first two ribs, okay, or the upper two ribs are okay protected by clavicle. Okay, while the last two ribs are floating ribs not connected anteriorly and okay lies in the part in thoracic wall and the part in the abdominal wall muscle, so more or less liable to be fractured. Regarding the thoracic inlet, okay, choose the correct answer. Okay, its plane is horizontal, its plane slope downward and forward. Okay, its plane slope downward and backward, its plane slope upward and forward. لا، its plane slope okay downward and forward، يبقى نازل لقدام ولتحت، يبقى downward and forward. Regarding the ribs, one of the following is atypical rib. مين اللي من دول is atypical rib؟ اوكي، بقول لي الفيرست والسكند والثيرد والتنس ريب، يبقى مين؟ هنا في نقطة يا ولاد، دي از هو يقصد هنا الاي ما دام بعيد عن حرف التي يبقى يقصد بقى typical. اوكي، مش atypical direct زي ما قلت انا في الاول. يبقى اقول this one of the following is atypical rib. هنا مين اللي typical فيهم؟ اللي هو الثيرد ريب. ليه؟ الفيرست ده atypical، السكند دي atypical، التنس ريب دي atypical. Regarding the void process of the sternum, choose the correct answer. بيقول لي usually remain as cartilage till the age of what? till the age of 40 years. يبقى بتفضل cartilage لحد age of 40 years. يبقى ممكن من خلالها في الفورنسيك ميديسن اللي هو في الطب الشرعي، تمام كده، نقدر we can detect the age of the victim، الضحية. لو احنا لقينا حد نقدر نحدد الايدج بتاعه. Regarding the suprapleural membrane, choose the correct answer. The apex is directed anterior، لا هي posterior. The apex is attached to transverse process of T1، لا هي T7. Okay, the base is attached to outer border، لا inner border. It prevent inward suction of structure at the root of the neck during inspiration. الأخيرة دي هي اللي صح. Thank you very much. Okay.